My name's Noel, I'm your host, and we've got a fabulous guest tonight, Jen Unwin, who I'm really looking forward to talking to, who's going to be talking to us about all things sugar and addiction around that. So we'll catch up with Jen in just a minute. Before we do that, just to remind you, it's a live show. It'd be lovely to have your contributions. We're streaming on a variety of platforms, YouTube, Facebook Live, and also on Periscope on Twitter. My team will be sort of surfing around and looking for your comments, so drop them in there and hopefully they'll pass them on to me and we can answer them. You can also give me a call, 07506 319 745. That's +44 7506 319 745. You can drop me a line on WhatsApp or call me on VoIP, etc. Good to hear from you. Enough of that, on to introducing Jen. Hello, Jen, how are you doing?
Hello, Noel. I'm really good. Thank you. Thanks for having me on. I'm really excited. I didn't realise people were going to interact. That's great. If we can get some questions and comments, that would be brilliant.
Really good. Yeah, we don't always get people. Sometimes it comes after the show, but yeah, it'd be really cool. And people have a really interesting comments and experiences, I think. And how are things with you? How has the last year been, now that we're on the 1 year and 1 day since the first lockdown?
Yes, it's been interesting. I mean, we couldn't really have imagined it, could we? It's been interesting for us because we've obviously been confined to quarters like everyone else, and we had a lot of things booked in terms of conferences and travel, so that's all been online. But it's been kind of restful in other ways, and it meant I had time to write my little book that hopefully we'll talk about.
Right.
And yeah, so there's been, it's been a curate's egg.
Good. I mean, yeah, nobody could have predicted this. I remember right at the beginning, sort of for several months actually, I'd have these days or moments, not whole days, but moments when I'd be sort of going, is this actually real?
Yeah, you wake up, don't you, and you think, is that real? Yeah, and we all had COVID quite early on, so we kind of got it out of our systems early on, and we weren't too ill, fortunately. So
good. And I had my vaccine last week. I'm glad to say I started it. I had the AstraZeneca vaccine and haven't turned into a zombie yet or died of a blood clot or anything like that. So there you go. If I have anything to go by,
and I'm having mine on Sunday. So yeah,
right, good stuff. I would encourage everybody to get out there and get your vaccine as soon as you can. It's really good stuff. It's great to be heading out, but interestingly, I don't know if you've been experiencing this in people that you've been talking to, but quite a lot of the people that who I'm patients, for example, and I've talked about how anxious they feel about this next period of time as we move out of lockdown.
yes.
And of course, there's that thing where we think, coming out of lockdown, yeah, and then you start to get these anxious feelings and go, oh, where are they coming from?
Yeah, and it's interesting, isn't it, how adaptive humans are. So we've all kind of adapted to this new way of life. Well, I know some people have struggled, so it's not everybody who's found it easy, for sure, depending on people's circumstances. But we kind of adapt, and then the idea of change again is a bit and particularly actually on the topic of the food, because some people have found it kind of helpful if you've got a food addiction problem and you've just been in charge of your own food at home. There's been no socializing, there's been no going to restaurants. For some people that's actually been good, and they've spoken to me about oh wow, I'm going to have to think about when people ask me out to a restaurant, what am I going to eat, or when people ask me for a meal, or I go back to the office and there's cupcakes on the side, and they haven't had to deal with all that. They've been in a kind of controlled environment. So I've definitely heard people speaking about from that point of view.
Yeah. And of course, your specialism at the moment is working with people around issues around food, and in particular, carbohydrates and sugar.
Yeah.
well, carbohydrates are sugar, so
Exactly. Yes,
it's
they
the
are.
same thing, but two words for the same thing, and sort of working with that. But tell us before we jump into that, and then we can also definitely talk about your book, which undoubtedly will be a fantastic resource for people. So we do want to talk about it. Tell us a little bit about your background. You're a clinical psychologist. What is one of those strange odd beasts?
Yes, there's not so many of us around, are there? Although there's more than when I first trained. There was only about 2,000 in the whole of the UK. So,
Yeah,
a clinical psychologist, they've always got a psychology degree, and then they've usually done some work in the NHS, in a psychology service or some research, something similar to that, and then they go on. And these days, it's a doctorate. It's a 3-year
yeah,
doctorate training in clinical psychology, and clinical psychologists are trained to work with behavior, thoughts, and emotions, and we're trained to work with children, older adults, people with learning disabilities, and then people usually specialize in one area. And I
yeah.
specialized with adults, but particularly in health, which is the sort of new specialism. So I'm a joint trained clinical and health psychologist, so
Okay.
specializing in helping people with chronic health conditions
Yeah.
was what I did for the 32 years that I worked in the NHS. So pain, um, uh, other chronic conditions that can sort of challenge people's quality of life, like asthma,
Hmm.
diabetes, those sorts of conditions.
And people might find it odd that a psychologist would be involved in health. But we'll talk about that and get onto that. If you don't mind, I'd like to just stay with these words because I think like labels about psychologists, psychotherapists, psychiatrists, doctor,
Yeah,
you're a doctor, but you're not a doctor, all of
yeah,
that sort of stuff. I mean, it's sort of, there's a lot of these words around, and I think people do get confused about them. And it's worth sort of maybe just unpicking that a little bit, and then we can dive into this sort of health psychology that you've been doing, which I think has been fascinating. So
yeah, yeah.
you're Dr. Jen Unwin,
Yes,
and so you're a doctor,
of psychology,
right?
not of medicine. Yes.
Okay, okay. So you're not a psychiatrist then?
Yeah, so you're quite right. So psychiatrists are medically trained. They do a medical degree first, and then they
Right.
specialize in psychiatry, and they can prescribe drugs. And obviously, they, usually have access to hospital beds or emergency beds,
Yeah.
or those sorts of medical treatments for mental health problems.
And
So
it's interesting because in America, if you're a clinical psychologist or the equivalent, the same level, you can prescribe medication.
yeah, and there's been a big debate here about
Yeah.
whether psychologists should take up prescribing rights, because obviously there are nurse prescribers now, and
Yeah.
so on.
Yeah.
I'm kind of against it. I like the idea that psychologists specialize in um, the psychological side of problems, and using those kinds of interventions with people, and that the psychiatrists, obviously, I know, there's many psychiatrists actually who are trained therapists as well,
Yeah.
but that will leave the prescribing to them. I like the idea that there's that sort of blue water, but I know there's a lot of debate about it.
Yeah. Yeah,
Um,
interesting. And what's the big difference if there is a difference between, say, a psychotherapist and a psychologist?
yeah, I think psychotherapists can come. I mean, so clinical psychologists could train to be a psychotherapist. It's a specialist training.
Yeah,
Um, but psychotherapists could also come from different backgrounds and train in psychotherapy. So,
yeah,
so nursing, social work.
yeah,
Um,
yeah.
yeah,
Okay. So psychotherapy is sort of more of a set of tools and techniques for helping people therapeutically.
yeah, and then obviously there's a number of models of psychotherapy to get even more complicated. So
Okay.
there's sort of
Yeah,
psychotherapeutic, more psychoanalytic work. There's
yeah,
CBT, that people will have heard of, cognitive behavior therapy, which clinical psychologists can do if they're trained to do it, but so could a social worker or a nurse if they're trained to do it.
yeah.
My particular uh, specialism was solution focused brief therapy, because it just worked really well in a hospital setting.
Well, tell me about, I mean, I know a bit about it, but not that many people have heard of it. It's a really successful way of working with
I
people.
think, yeah, it
Yeah.
really
So
is.
tell me a bit more about solution-focused brief
Right.
therapy. If
Yeah,
you
well,
don't.
that started off in the States, you know, some while ago now, I think in the 60s, and it sort of started off in family therapy settings.
Yeah.
And what they noticed through observing was that where a family had talked extensively about what they were hoping to get out of the therapy, what their best hopes were from the therapy, that progress was more rapidly made,
Yeah.
and it's now used, yes, in family therapy, in education, in social work, in lots of different settings, even in business settings as a sort of coaching model.
Yeah.
And the idea is that, yeah, the first step is always that you establish what the person's idea of better is, and
Yeah.
that can take some time, obviously, if people have a very in the problem, or you know, really having a lot of difficulties. But taking time to kind of define what better would be starts to give people that sense of hope and hopefulness, and some sort of a vision of what the future that they want might look like.
Yeah.
And then moving.
And also, I think it also reduces the risk of people just running from one place to another psychologically, which is exactly the same. Like, I don't like where I am, I'm just going to try and escape it without thinking about, well, where am I escaping to? And often if people are just in escape mode,
Yes,
then they end up in the same place and
exactly.
repeat the same mistakes again and
That
again and
can
again.
100% happen with addictive problems that we'll probably get onto. So you
Yeah.
can just swap one swap one addiction for another.
Yeah.
It's about thinking how you'd live a life free of whatever it is.
Yeah.
uh, and then the next part is really working out what's already on your side. So
Yeah.
there's always exceptions to problems. There's always times when there's little glimmers of it not being present or being less present. So even with when
Yeah.
I was talking with someone with chronic pain, I'd say in a very respectful way, you know, are there any times when it's even slightly better? You know, are there any days or times when you notice it's slightly less, something like that? And they might say to me, oh, well, I do notice that when the grandkids come round, you know, I don't think about it as much. And that's a little glimmer of something that's hopeful. So you can explore all that and what their personal strengths are and who's around supporting them, and, you know, working out what's already going well. And then you know where you're trying to get to, you know where you are now. And then you question about, well, you know, if you were a tiny bit nearer to where you're trying to go, or you know, what would be the first tiny sign that was something was improving. And it's lovely because it's a very proximal thing, and it's about,
Yeah.
as I say, just small. You're not even saying to somebody, how will you get there? You're kind of saying, what will it look like? And then some kind of special magic happens with solution focus, where you have those kinds of conversations with people, and they go away and they think about what you've said, and it's a different focus for people who've been very embedded in what's going wrong and what's not working. And then you often find that people come back and, you know, they're telling you about something that's gone better, or something that's worked a little bit better, and then you can just continue that. And it's a
Yeah.
very hopeful form of therapy. It's also very let's say risk free, so you're not sometimes when you're going back with people through difficult experiences, um, people can feel, you'll have experienced this yourself, they start to be a bit worse before they get better. And sometimes you know, you can yeah, people can not do so well with that.
Yeah.
Um, and so it's quite a risk-free kind of approach, and it's easy to train other people to do it. That's the other thing I really love about it, is
Yeah.
you can train people in the concepts quite quickly, and they can start to ask those kinds of questions. So I've trained David, who's my husband, he's a GP, and we've been working with people with type 2 diabetes, helping them to
Yeah.
change their lifestyle choices. And I've trained him to do solution focused interviewing in his 10-minute appointments at work. And
Yeah.
we've got a paper on it that we could always append to the show notes, I've kind of adapted it, and it's a model called GRIN, which is goals, resources, increments, and noticing. And it's basically solution focused, but just packaged in a simple way for healthcare professionals. And I've written it as a paper. So yeah, so I love the approach. I think it fits really well with addiction. It fits really well in hospital settings. But I mean,
it sounds very pragmatic and empowering.
yes.
There's no ideology involved. There's no, this is my approach, you must follow it. It's more like, well, let's find out what works for you. What does working for you feel like and look like? And let's try and do that more.
Exactly. It's not like I'm the clever therapist kind of thing. It's more like you're the clever patient. Let's just kind of draw out your expertise and build on that. Yeah. So it's a lovely patient-centered, empowering way of working.
It's also, I mean, it's sort of intuitively correct, isn't it? If we focus on the solution rather than the problem, surely that's got to make more sense.
Yeah. You don't have...
It's like, it's obvious when you say it. I mean, you know, people are caught up in the problem just because our brains are trained to look for problems.
Exactly. It's human nature.
We obsess on the problem, don't we? You know, it's like our amygdala is going, it's a snake, it's a snake. And we're like, no, it's not. But it is a snake. But taking us into the solution, which is very much, I think, the approach that happens in a lot of these peer-to-peer groups around addiction and support groups and all these things that people do on Facebook. I've had enough of it. I want what's worked for you. Can you tell me what's...
Tell me about that.
Yeah, that sort of stuff. These are my solutions. Give them a go and see whether they work for you. Oh, that one did, that one didn't, and then all of that sort of stuff. So it's very sort of empowering and leveling, I suppose.
Yeah, absolutely. And it works really well in groups, actually. You mentioned about sort of Facebook, but you know, I loved running groups because you would start off with a few of those kinds of questions, and then exactly as you say, everybody jumps in and contributes, and what another person who you identify with says carries so much more weight, you know, than even the professional who says it. I mean, they just we found that as well. We run groups for people with type 2 diabetes, and it's great. You just bowl a few things in, and then you know the magic happens.
And it's interesting, I think, because I remember because they moved addiction services into Public Health England a long time ago, for the reason that we need to work more holistically with these things rather than treat the problem once it's happened, is get in beforehand and empower people not to have the problem in the first place, or to reduce the severity of the problem. But in there, they were talking about the power of groups and the power of connection to other people as a hard health outcome. So I think a lot of people think that, you know, if you do a therapy group, it's nice, it makes you feel better, but it doesn't really do anything, does it? Whereas in fact, the evidence is you can increase your lifespan if you've got a good support network around you.
Yeah, we're human beings, aren't we? We're social animals, and there's the whole thing about mirror neurons is something that I really like. Is that we want to sort of fit in with the group, so we tend to sort of, you know, do what the group does and think what the group thinks, and that's so relevant with something, any kind of addiction, but you know, particularly sugar addiction. We might be the only person we know with that problem. So if you can find a group, and this is the joy of Zoom and online, you know, it's kind of revolutionized the fact that you can now find your tribe and you can listen to other people. I've just done a Clubhouse. I don't know if any of your listeners are on Clubhouse yet, but I do a Clubhouse on a Wednesday night at 6 o'clock called Fork Road. And it's just lovely. We get the same people, you know, a lot of the same people every week, but they come and they share, and we're learning their stories, and it's just brilliant. There's people from all over the world, so we wouldn't be able to connect with those people if it wasn't for...
It's interesting. I think some people might be surprised. I mean, I happen to know this, but I know that when you're talking about addiction, you're talking about addiction to sugar, aren't you? And people might be thinking, oh, she's talking about heroin addiction, or she's talking about... But you're not, you're talking about sugar. So let's talk about the addiction as you see it. And it's slightly controversial to use that terminology in the UK. In America, it'd be hands down, no problem. But you're campaigning to have it recognised, I think, in some ways, aren't you? That as an addiction. So tell me, is sugar an addiction? I mean, what's going on then?
Yeah, so it's fascinating, isn't it? And it's, as you say, it's not officially recognised as an addiction in the two sort of diagnostic manuals that we know of, the DSM-5, which is the American Psychiatric Association in America, and the ICD. We're nearly on to 11, aren't we?
Yeah.
Which is published by the World Health Organization.
Yeah.
So things like like gambling addiction is now recognised in the DSM, but not food addiction. But if you actually look at certain people's behaviours around food and you compare them to the criteria for substance use disorder in the DSM or in the ICD, you see that people actually would endorse that. So if we sort of ran through some of them, which you'll be familiar with, which are things like cravings that are hard to resist, using despite knowledge of harm, using to reduce withdrawal symptoms, wanting to stop but not being able to. There's a certain proportion of the population who find that to be true with sugar, refined carbohydrates, and ultra processed foods. And if you look at the kind of both the animal studies and the human brain studies, and you look at the where the bits of the brain light up, and you compare the brains of alcoholics, cocaine users, and food addicts, they look. It's the same part of the brain. It's the reward center, the sort of nucleus accumbens and the dopamine sort of releasing areas that all light up in response to whichever drug it is. And
the food that you're talking about really is that sugar-rich, carbohydrate-rich food, ultra-processed.
Yes, ultra-processed foods, sugars.
So the same thing is not happening when we munch on broccoli or something like that.
Exactly. So the proper human diet, which is meat, fish, eggs and vegetables, or the sort of original diet, we do get dopamine, because dopamine's often about survival, isn't it? So we do get a dopamine boost with food, but the boost that you get with refined sugars and refined carbohydrates is elevated, as it would be with alcohol or drugs of addiction. And then, of course, what you get is that the brain tries to regulate that. It likes it. It's going to cause the cravings for future consumption, but it also wants to down-regulate those high levels. So you get the receptors dampen down, so that next time, that this kind of another signature of addiction, isn't it, is that you need to have more and more to get the same effect. So that would be with alcohol or drugs. And again, some people will recognize, some listeners might recognize this, that maybe one slice of cake used to be enough, and then it becomes 2 or 3, or for some of us half a cake, and if nobody's looking, maybe the whole thing. So you get that sort of that adaptation to the drug. And then, of course, it's not a great thing to have your dopamine receptors downgraded, nor your serotonin gets involved as well, so nor your serotonin receptors, because obviously when those are dampened down, you're more likely to experience low mood. And we do know that high sugar diets, high carbohydrate diets are linked with depression. Type 2 diabetes is linked with depression, and that's probably because our neurotransmitters are getting kind of flattened down. But then we're chasing the dragon, trying to boost ourselves up temporarily by having sugar. And people even say, don't they, getting your sugar fix is something that people say to actually kind of buck you up. Yeah.
And we should, I mean, I'm aware that, there are various issues here that we need to look at in things, so there are people who are obsessed with avoiding carbohydrates, who have an eating disorder, which is called anorexia. And we're not talking about that. The anorexia is a very dangerous condition. And we're not even necessarily talking about the other defined eating disorders as such. So we're not talking about bulimics or probably are talking more about overeaters, but in the UK, overeaters are, go on.
I was just going to say there's a big overlap with binge eating disorder and food addiction. Over 90%, when you look at the research, it's massively high. So it's possible that there's a similarity there, and sometimes people who restrict to a great extent, they do that because they then feel in control of what they're eating, whereas when they eat sugars and carbohydrates, they feel out of control. So there may be some kind of addictive component.
Well, I mean, there's a body of opinion that says that eating disorders are part of addiction, and I think this is where I come from. I don't think we know enough about it to be able to refine our understanding.
Exactly. I don't think there's been enough research, and I think part of the problem with that is because food addiction hasn't been acknowledged. I think if it was acknowledged as a diagnosis, then there would be more funding for research. We could answer some of these questions about what's the overlap, what are the distinctions. I think it's possible to have food addiction and an eating disorder, for example. You could have both. So it's like you say, it's complex. We need to kind of do a lot more research. There need to be a lot more intervention studies, and those won't come until there's a proper recognition that it exists and it isn't a sort of mythical unicorn.
No, I agree, and it's also, I think we should say, it's very serious. It's not. It's not something that's funny. I mean, I would say it's behind a lot of the sort of crisis we have around diabetes, the crisis we have around obesity, the fact that we have NHS wards all dedicated to lopping people's limbs off because of diabetic problems. All of that, I think, is linked to this. I don't know what you think, but I think it's a big driver.
Absolutely, it's life and death for some people, and both in terms of their mental health and in terms of their physical health. We've had people in our groups in the practice. There's one particular lady who's was in a wheelchair, was incredibly ill, in a lot of pain, and she's now lost, I think it's about 9.5 stone, is out of her wheelchair.
Great.
And she just talks about the fact that yes, she was addicted to sugar and carbohydrates.
Yeah, and it's also one of those things that, in a lot of addictions, the stigma around it is huge, and it's misunderstood so much that it's almost like people will argue, well, it's just willpower, isn't it? Why can't you just stop?
Why can't you do moderation? And
exactly, right.
To some extent, I think that's a message which the food industry wants us to swallow, if you'll forgive the metaphor, that it's a matter of individual will, and it's okay if you have a Mars bar in the context of you've played a football match or whatever it is. And actually they know, the food companies know, they design this stuff in labs to be irresistible. The kind of bliss point stuff, things like Doritos and Pringles are actually marketed as you can't just eat one. No, we can't, because they've got that sort of perfect salt, sweet, fat combo that that human beings, for evolutionary reasons, do do find it irresistible. Yeah, so that
let's go back and talk about that, because I think it's really important for people to understand the sort of neurological pushes that are going on and the programming within us, and understanding, because I think a lot of these behaviors can look insane unless you understand the neurological substrate.
the evolutionary sort of
Yeah,
reasons behind it as well. So we don't have such a good off button for sugar and carbohydrates.
yeah,
The reason being that obviously to survive the winter, in the autumn we had to gorge on whatever was there. So there was no good if we had an off button. We had to just be able to sort of eat the fruits, eat the nuts, whatever we could find. So those kinds of foods are very palatable. We love
yeah,
them. They give us a bit of a dopamine hit. We kind of remember where they are. So if there's some biscuits in the house, those of us who have this tendency will know exactly where they are, how many are left, and they'll be kind of calling to you. And
yeah,
that's the primitive survival part of your brain doing what it does best, which is driving you to sort of eat that stuff to survive the winter.
yeah.
And now, of course, these days the winter never comes, does it? Yeah, and yeah, it's the dopamine is all to do with cravings and habits, and
Yeah.
every time we have something, our brain is rewired a little bit. We noticed it's like the smell of our favorite thing, or the color, or the shop that sells it. If we go on our way to work, we always stop at let's say the Costa and get
Yeah,
a Danish and a latte full of
yeah,
pumpkin spice sugary mix or whatever it is.
yeah,
Um, that becomes a habit.
yeah.
Um, yeah, yeah. Does that?
And this process as well, which I think people understand with something like alcohol, where you build up a tolerance. And because you build up a tolerance, you have to increase the dosing. Or
Yes.
certain people do, not everybody does. And we should make that distinction.
Yeah, we should certainly with food as well. It's probably between 10 and 20% of the population who are going to have these kinds of struggles.
Which is exactly the same figures as all other substance use disorders.
Yeah.
And it's the same figures globally, everywhere you go. It's also, we have monkeys that have substance use disorders, we have horses, bees. And we know that when it's transcultural, when it's transhistorical, when it's trans-species, it's not personal choice. Mother Nature has put this in us for some sort of reason.
Gave some of us this special brain, and there probably is some
That's right.
genetic factor. When I interview people, I know my mum was almost certainly a food sugar addict. I hadn't kind of worked all this out, unfortunately, before she died, so we never got to talk about it. But from her behaviour, I would say, often I talk to women whose dads have maybe had an alcohol problem. That's quite a common thing, actually, where the dads had an alcohol problem, and then the children have maybe have a food problem. I mean, it's not 100% sort of relationship.
Well,
But
alcohol is sugar. I mean, it's just one of the things you do with alcoholics when they first come into abstinence is you do definitely replace the sugar with sweets for them so that you reduce the alcohol cravings. It's one of the things that happens. And particularly for guys in alcohol recovery, food is almost immediately the next one that they smash into, because it's replacing all those carbs.
Yeah, and it's a similar kind of, it's soothing. You get the dopamine, serotonin, endorphins. It's a similar sort of thing process in the brain.
I mean, so it's a very serious thing. It's still misunderstood, I think, in many ways. It's a chronic problem. I'm wondering, we've talked a little bit about inheritability, and I'm wondering what you think about this idea of the link between addiction and trauma. Now, I think some people talk about a very simplistic link, which is you experience trauma, you're going to develop addiction. Well, that's not true, because there's plenty of people who have experienced trauma don't go on to develop addiction. They might use substances to manage uncomfortable symptoms, but when they get better ways of managing it, they stop. And that's not true of an addict. They will carry on with the addictive behavior, even if they get good treatment for trauma, for example. So it's not a simple one-to-one, but there is research, and I wonder what you think about it, that addiction is more like an intergenerational adaptation to trauma as a survival mechanism. Because one of the things that can happen, say if your great grandmother had a significant trauma, and we know trauma is encoded because it's epigenetic as an experience, so it gets written, particularly in the amygdala. And then later on down the generations, if somebody significant has had significant trauma, there can be a couple of survival mechanisms, one which is less successful than the other. So suicidal despair seems to be one option, and addiction seems to be the other one. And out of the two, addiction seems to be the one that gives better survival options. I don't know if you've come across those types of ideas and what you think.
It's fascinating. No, it's fascinating. Yeah. I haven't really. I think that certainly in the people I've spoken to, I don't think the research hasn't really been done in food addiction and trauma.
Yeah.
But people I've spoken to, there often is something there, whether it's sooner or later.
Yeah.
Sometimes not. People were just from very young, very drawn to sugar and carbohydrate, and then that carried on, and that has caused them obviously later on problems and difficulties. But it wasn't necessarily triggered off by trauma.
I mean, I remember as a child, because I came from a home where there was lots of violence, and my father was a violent drunk, etc., etc. Yeah. And one of the things that used to happen was after an episode, we'd be given sugar to soothe ourselves. And it would work. I mean, it was sort of without a doubt. We were given white bread, buttered sugar sandwiches. And so there was loads of fat and sugar and all that sort of stuff. And we would go into bliss.
Yes.
Having been very, very frightened. So we were trained into using these things as a way of soothing.
Self-soothing, yeah. Did you know that, so when you have sugar, obviously insulin goes up because insulin is to get sugar out of the bloodstream. When insulin is high, tryptophan can preferentially cross into the brain, which it can't normally. It's normally competing with other things. So tryptophan can pop it into the brain, and then tryptophan's the precursor of serotonin. So you get tryptophan serotonin conversion quite quickly. And serotonin is the happy, soothing, contented. It's why we all fall asleep after Christmas dinner, isn't it? But exactly, the sugar is going to have that effect.
Okay, so let's talk a bit more about it, and sort of what you're suggesting is the possible solution to these things, so we've established, for example, it's got the same profile as other substance misuse disorders, and similar populations are involved, and that there's a strong link to certain, if not all, eating disorders. And though eating disorders in the UK tend to be classified as anxiety-based disorders or expressions of an anxiety-based disorder, which you could say addiction is part of as well, and it would certainly fit that profile, but maybe also a depressive-based or a trauma-based disorder, all of those things are involved. So it fits in that. There's a move towards understanding it and establishing it as an addiction so that it can be established within the research, and that's important, so we gain knowledge. In terms of, if somebody finds that they're listening to this, like I'm listening to, going, I've eaten too much sugar today, sort of, and actually for this last year I've eaten too much sugar, and I know why I'm doing. I'm clever enough to know why I'm doing it, which is there've been uncomfortable things that I've been going through, and I know it's a go-to of mine to eat some sugar. But let's start talking about what the solutions are and the ways of dealing with this and how we might be able to help people.
Yeah, absolutely. Well, so the solution to other substance use disorders is abstinence, obviously.
Right.
Now,
is that obvious to people? Why abstinence, and what does that look like with food?
With food, what does it look like? Exactly, that's the big question. So, obviously, if somebody's lost control of their relationship with alcohol or other substances, then the recommendation would be to not have any alcohol, or if it's gambling, to not do so, to be abstinent. So you're exactly right. The trouble with sugar and food addiction is,
and that recommendation, sorry, I want to nail home this point, as so that people think it's people, health professionals making moral points. We're not. We're talking about what's happened inside your brain, which makes it impossible for you to moderate and control.
yes, because that you kind of come to that point where you realize that yes, it's not about willpower and trying, because you've tried everything and you've done everything, and you've probably tried a million kinds of diets, and had a million rules around certain things, like biscuits, for example, and always failed with that. And yeah, it's absolutely not a personal failing or a moral failing. It's your brain's been hijacked, and for whatever reason, you're one of
And
those.
dopamine is literally the on-off switch. And if you've messed up dopamine and the receptors in dopamine, you've messed up the on-off switch. And you may well have been born with that mess up. The D2 receptors aren't working, etc., etc., etc. So that's like, I can't find the right part to replace my central heating system. So I've got a wonky central heating system.
Yeah.
And that's just the way it is, folks.
Or I say, and you wear glasses like me, so I say, listen, I'm short-sighted. Wasn't anything I could do about it. Born that way. My mother was short-sighted. Wear glasses, all good. So it's like, how do we find the glasses for this for this problem? So as you say, it's a tricky one for food and sugar addiction. We've had it since we were little, like you said, so our brains are very wired. On the whole, we don't give children alcohol and cigarettes and caffeine.
No, that's right. Or heroin
or heroin. Sometimes
exactly.
we do, but we give it to kids. It's a psychoactive substance, so I'm hoping people listening will think twice about giving it to their kids as a reward. So our brains are already sort of really, really wired into it, number one. Number two, the society that we live in is incredibly sugar saturated now, much more than when I was little even. I mean, we used to, as a special treat, get a packet of crisps and a can of pop on a Friday night, and that was kind of the highlight of the week. These days, there's crisps, pop, chocolate. Every celebration's chocolate focused. Everywhere you go, in the office, in the garage, it's everywhere, isn't it? Chocolate. I mean, you just can't get away from takeaways and carbohydrates.
And sugar is also added into everyday processed foods.
Every day.
And you can't taste it. You don't even know that there's 10 teaspoons of sugar in something.
It's in things you wouldn't imagine, like coleslaw and hot roasted chickens and things that don't need to have sugar in them.
And white flour is effectively sugar, right?
White flour digests, just glucose molecules holding hands, as my husband would say. So it digests down immediately into sugar. Bread, rice, pasta, and a lot of our meals are based on carbohydrates. And we've been told it's good to have carbohydrates, cereals for breakfast. So it's everywhere. So abstinence is a little more difficult than it would be, say, for cigarettes, where these days it's actually behind a curtain in the shop. You don't have to have them in the house. You don't need to breathe in cigarette smoke. Alcohol, I think that's maybe slightly more difficult, because it is, again, a societally very accepted thing to do. And people bring you bottles of wine and that kind of thing. But food we have to eat. So the main thing is to work out which foods it is we need to be abstinent from.
Okay.
It's sugar, flour, as you say, processed foods are the best places to start. And just to start making small changes. I mean, some people go cold turkey, but that's you can do that. I did that. It's a bit radical, and you certainly shouldn't do that if you're on diabetes medication or any other medication. You should check with your healthcare professional. You can start cutting things down, like maybe if you're having cereals for breakfast, think about having eggs or something that isn't carbohydratey and starchy, something that's got good nutrition. Proteins and fats in. The brain loves fat. It's made of cholesterol. If you think, like we were talking about kind of evolution, if we think about what we evolved to eat, protein and fat is good from that perspective.
Well, let's talk about fat a little bit, because I think fat got a bad press for a long time, and that was because the food industry knew how addictive sugar was. And that's not a conspiracy theory, that's the truth. And we were completely blown away by all this nonsense about fat. If you eat fat, you're going to get fat, which is absolute rubbish. Fat is, over to you.
Fat is you need it to make all your hormones. The brain. It's a form of energy, particularly if you don't, like me, you don't eat any sugar or carbohydrate. Yeah. Fortunately, we're a dual fuel engine, so you can run on sugar and carbs. But the trouble with that is you have up and down energy throughout the day, or you can be a fat burner. And the brain loves it when you're a fat burner, because the brain loves ketones, which is the fuel that the body uses when you eat fat. Yeah. It was. And
your liver turns sugar into fat.
Into cholesterol. Woohoo. Yeah. So cholesterol in the blood bears no relationship to the cholesterol that you eat. Big surprise, because we all thought that was the case, and everybody said don't eat eggs. Actually, your liver manufactures cholesterol. I mean, partly because your body needs some, actually. Yeah. So those of us that were on a very low-fat diet, which I've done in the past, your brain needs cholesterol, your body needs cholesterol, so your body was manufacturing it itself.
Yeah. Yeah. And so there have been some big myths that have needed to be busted. The big myth is that sugar is a good thing. It's not. And I want to go back to some of these things about kids and how we reward children. We reward ourselves with sugar, particularly I don't think most people understand just how much of a narcotic sugar is when we've had a shock, for example. And I would imagine, I don't know if this is true or borne out by figures, but I would imagine that people have been using that narcotic the last year in quite significant numbers.
Yeah. So I think we were talking, weren't we, about some people, have actually, because they've been in control of their environment, it's actually been quite a good thing, and they've been able to some people have seems to have gone one way or the other. People have got really fit and got control of their diet because it's been a bit of a more controlled situation. I think other people have found it really hard. They've maybe had a really stressful time, and they've gone hard on the booze and the unhealthy food.
Sure. And so we're looking at people come blinking into the open again as of Monday, because we're no longer. We're now allowed to leave home as of Monday here in the UK, and looking at getting back to or moving into a slightly healthier way as social animals. How much of this stuff that's been going on, and I think this links to the addiction thing, this increase in the need for narcotics to manage stuff, is about the fact of the distress as social animals that we've been experiencing through this period of time, particularly around the inability to hug and kiss and touch and meet up with people that we love and care about.
Oxytocin, another really
exactly.
I talk in the book about getting your daily dose, DOSE, which is dopamine, oxytocin, serotonin, and endorphins, and trying.
That's exactly right. That's brilliant. I'm going to steal that. That's
you fantastic. Have that. Trying to sort of weave those into our lives as part of, particularly as part of recovery, and oxytocin. I feel really sorry for people who live on their own or are up in a tower block and they can't get out easily and into the fresh air and
or
exercise, or they're worrying about their elderly relatives that are stuck in a care home or something. I mean, there's been a heartbreak for so many people, not to mention the financial worries. It's completely makes sense that people turn to some kind of comfort, whether that's food or alcohol.
what can we do that's different? I mean, I live alone. The only person in my bubble is my son, who lives in France. So I save up all my hugs for when I go over and see him. And I think he gets damn fed up of it, because I turn up and I'm just a hugging monster who doesn't want to let it go. And he sort of, after a couple of days, it's like, enough, let's go and do something. But how can we help people sort of, because we know that this is stressful stuff. And I think one thing's about social isolation and addiction, there's a strong connection between the two. And again, it's that sort of vicious cycle people get into. As they become more dependent on the substance, they become less attached, less dependent in a healthy manner of people.
Exactly.
Again, more and more. And you
they
get,
withdraw to use more,
right.
or because they feel ashamed. They tend to withdraw from social activities and
And as a psychologist, you probably feel a bit like me that this stay-at-home order, which has been necessary for health reasons, is so anti-human that we knew it was going to cause distress to people, and people were going to try and soothe that distress. So what might we be able to do now, do you think, in terms of, I mean, we're encouraging people to, tail off in terms of their sugar usage, and what you would recommend, sort of food diaries like you would with alcohol diaries or something like that, some practical tools?
Yeah, possibly, if that helps people. To try and sort of, make sure you prioritize the healthy stuff first. So that you're getting, I think often people who are worried about how much sugar and so on they're eating, they to try not to eat much, so they're not getting the nutrients that they want, and that's only going to make cravings worse, because if your brain senses it's sort of starved of nutrients, it's going to drive you to eat more. So make sure you're getting your protein and your fats and your low carb veg. Plan those meals out, and prioritize those, 3 meals a day, and that you won't be as hungry, in a sense. And then try and swap stuff out, David I did the cold turkey, but he did a transitiony thing where he used to eat a lot of biscuits, particularly at work, because he was stressed. So he'd have a biscuit in between each patient. So to sort of give him a boost. So he swapped the biscuits out for little oat cakes. And then eventually swapped the oat cakes out for almonds in the drawer. And now he doesn't need anything in the drawer at all. So he's sort of transitioned off it. And I think if you can do that's great, just sort of replacing things.
And I like the idea, rather than cutting things out, do the replacing, which is moving into the solution rather than focusing on the problem. The problem is I'm going to cut out the problem and then I end up with nothing. And that's how it can feel, as opposed to maybe I'll just grow and dynamically grow into a new way of doing
life.
Exactly. I've got a question that's come through, which I think is a really good question.
Great.
I'm not sure who it's come from, but it's one of my team, Jennifer, has sent it through. She said, so whoever asked this question, I'm sorry I don't know your name, but thanks for it. Is there something satisfying I can use to replace my sugar cravings at night? That's a great question.
Is there something satisfying? It's a lot of kind of low carb things that people who are sort of moving. So the people that we see are obviously type 2 diabetics. We're trying to get them onto a low carbohydrate diet, because that helps them to reverse their type 2 diabetes. And so what I might say to someone like that was, well, you can, what you can do is you can get some cream and whip it up, because we're not afraid of fat if we're not having sugar. Whip it up. You could have that with some strawberries. That's absolutely delicious.
Wow.
Or some dark chocolate. We usually go, they say kind of 70% plus, but I would say if you can go up to 85% dark chocolate, which is quite nice, you can melt that, and stir it into cream, and you get like a little chocolatey pudding. There's a lot of websites.
I'm having that tonight. I'm going to stop after this buying some cream and some dark chocolate.
Dark cream is the low carb, winner. There's a fantastic website called Diet Doctor. And it's kind of keto, low carb, website. It's got all the information, but it's got lots and lots of recipes as well. So that's a good resource for people looking for ideas. They're looking for the science behind it and trying to reassure themselves that it's a healthy thing to do. Go on there, look at the transformations, look at the nutrition.
And are you a fan of keto diets?
Yeah, fan of keto, low carb, yeah, anything like that. Is basically the plan for people with a sugar addiction problem is to slowly transfer onto keto, which is the sugar-free. It's basically protein, fat, vegetables, low carbohydrate.
And I've discovered recently, this is my own little tool that I'm going to give to people, is a juicer. I'm only 54 and I've discovered the joys of juicing. And that's how I now get my fruit and my vegetables into my life, because I've been a big kid about those things all my life. And I go through phases of eating them and then I get fed up with them. And it's actually delicious, the sort of combinations. So it's fantastic stuff. Thinking about some of the psychological consequences, though, because some people will have been medicating because they've got other issues and other problems. So for some people, substance disorders happen because they start taking the substance, and we should just know that. And then when you manage the substance, that's it. They just get on with their life and there's no problem. But for some people, they start using substance and then they have the underlying addiction encoded somewhere in their genetics. But they're using substance as a way of managing. And what would we say to them, do you think, in terms of what might look like a useful package of help, as it were?
So the two phases really. One is to phase out the sugar. It's still the same advice initially, but then
on the same basis that if somebody's chaotically using alcohol, for example, we would want to manage that because that's affecting their mood and their perception.
And they could, they can't really engage in therapy and so it would still be the same advice to start with, and then kind of see what you're left with, because as you say, actually sometimes a lot of the psychological problems resolve because the brain is so much better off sugar and alcohol. You get a lift of foggy brain, memory improves. As I say, depression can lift because actually the sugar has been keeping the depression going. So see where you get to, and then it may be a case of seeking some kind of help at that point, or definitely getting involved in a recovery community and focusing on those other things, as we were saying, focusing on building a life which gives you all of those things that humans need, like connection, daylight, exercise. Purpose is a big one, because often people have they've got depressed, they've lost their purpose, what
absolutely. I mean, meaning and purpose, sometimes people use the word spirituality, I think, but it's similar types of things. I think finding meaning and purpose now seems like a really good time to be looking at these issues for people who may have got caught up in some problems over the period of the pandemic. Now that we're coming out of it, you can, I think, confidently plan now for those other support networks, social contact with people, breaking down the isolation, joining groups, and not just being online. And the reason why I say that, and I think you know this as well, is certain things happen in real life neurologically that just don't happen on Zoom. Zoom is fantastic. So is all the other online platforms. It saved our backsides, if you don't mind me saying, this year. Really, definitely wonderful stuff. But actually, things like oxytocin don't necessarily get activated as much online. They do to some extent, but actually looking at somebody that you care about in their eyes and holding hands with a loved one, that's how you get real oxytocin into your system. So getting back to doing some of that stuff, I think, is we can now confidently plan. But I would go with you. I think people should take it step by step. And that's a sound psychological advice. When you feel like you've got a big problem, don't try and tackle the whole problem.
How do you eat an elephant?
Exactly, a bit at a time. Not all in one go, for sure.
No.
Absolutely not.
Yeah.
That's exactly right. That's exactly right. And that's a lovely place to sort of begin to end the show. Tell us the name of the book that you've written, and
Yeah.
how people can get hold of it and all that.
Yeah, so it's called Fork in the Road,
Yeah.
and it's on Amazon. So if you just Google put in Amazon Fork in the Road, Jen Unwin, you can get it on Kindle, which is the cheaper option. But do look at it on a tablet because you get the lovely graphics. It's always a beautifully illustrated book, or you can get the paperback version, obviously. And I've got a website called forkintheroad.co.uk, which I've just started. And there'll be lots of information on there for people looking for more resources, and there's me interviewing various people in the space, so you find out more there.
Great. And you're offering one-to-one as well as groups as a psychologist, or?
I'm a bit busy to do it at the moment. I'm doing assessments, and then sometimes I'm referring on to colleagues that I know that are really good for one-to-one. We're starting groups. We're piloting those. We're going to be collecting data because there's absolutely no research on outcomes in food addiction. So that is something we're going to be doing in association with my favourite charity, the Public Health Collaboration, phcuk.org, and all the profits from the book go to the phcuk.org.
Brilliant. That's really good news. I mean, there is a problem with groups and eating disorders, for example. The outcomes aren't great at times because people learn unhealthy habits from each other rather than healthy habits. And so having groups which are facilitated and monitored often can be more successful, I think. Initially, anyway, in the early days of people's recovery. Later on, they can become sort of leaders themselves. So that's really good news. So all of those links will be in the information with the show. We'll put a link to, my team will be doing it already. It's been brilliant to have you on, Jen. Really, really informative conversation about a really important subject, and very timely, I think. Just yesterday I was being interviewed on the radio, and jokingly, but also seriously, the interviewer was saying, all right, so I know that I have to cut down on my alcohol now. Fair enough, Noel. What I'm going to do with all those cakes that my mates are baking? And it's the truth. That's what we've been doing. And I said, yeah, it's really, really important stuff. So give it to a food bank, maybe, but don't eat it.
Don't eat it. Yeah.
Cut it down. So brilliant to talk to you, Jen. Really, really fantastic to have you on. Thanks everybody for joining us, and see you all again next week. And just bye-bye for now. You stay with us, Jen, as we go off air.